Hi, thank you for joining me today. In this presentation, I'm going to go over a couple different programs, counseling and health and human services. Ideally, I'd like to be a middle school principal, so the information in this presentation would possibly be presented to parents and students because it actually applies to them and it's important that they know the things that we offer. It would also be important for teachers, staff, and administration so they know what we are offering our families. The first program is counseling programs. Now, counseling is available to all students, and they even offer specialty services based on a different diagnosis. There's also self care and support that is for teachers and staff. They even also work with class schedules and those kinds of things. They do work a lot with the drug and alcohol abuse prevention and even family and parental support. So it's not just our students that are taken care of, it's our entire campus as a whole. Now, counseling programs, they do vary state to state, but in Texas, they must be a certified counselor and they must hold a master's degree. Counseling programs also assist with creating behavioral intervention plans and integrating them into IEPs. They also help kind of mediate things between teachers and families or parents and the administration. They do a lot of stuff like that. And they even participate in larger crisis response teams. For example, one campus might have a student suicide happen either on campus or just with one of their students. The counselors from our campus actually go and help when they need to do an immediate response. Some common misconceptions or mistakes that you'll find in counseling programs is that counselors will either label themselves as an educator first or a counselor first. So, one way that I'd like to work to monitor and kind of change that is to create clear goals and responsibilities. And that'll be based on the individual counselor, but then do the same thing as a department as a whole. And that will include the input and the work of all of the counselors. Another common misconception is that student counseling is only for sad students or bullied students or those students that they don't have anywhere else to go. Well, that's not true. They offer a wide range of services. Like I said, it includes scheduling for classes to make sure that everything flows well and every student's got somewhere to go. They work with choosing courses or even going into the high school program. And one way I'd like to kind of work with that is look to expand our program. I want to work outside of our campus to even support maybe some of the lower income areas that don't even have that offered on their campus or they have very limited amount of it. The next program are health and human services. So health and human services, again, available to all students, and they have support services that work for students with special needs. And it's not just limited to that. And there's also additional services for teachers and staff. So you need a Band-Aid, you can certainly go to the nurse. They're going to be able to help you with that. Well, the other services included in health and human services is food. They also work with the cafeteria and they make sure that everything is good and everything's healthy. This does include the on-campus nurse. There's even on some districts and some campuses, they have school-based health centers. They even have health centers off campus that are only for ISD employees. And the nurse and the health and human services do work with mental health services. So, to be part of the health and human services, mainly you are looking at your school nurse and they must be a registered nurse. Oftentimes, healthcare organizations sponsor different programs, and this could be those school-based medical centers, things like that, are sponsored by outside hospitals, outside practitioners, and the counseling department. When we talk about mental health, they work with the nurse to come up with different programs or crisis intervention, all kinds of things, and they work really well together. So some common misconceptions or mistakes that you find within health and human services is that it is just the nurse and nurses are only for boo-boos. Well, that's again not true. So a way I would like to combat this is to increase the collaboration coordination that we have with the outside healthcare professionals. And that could be outside events, it could be offer specialties, or even providing information on insurance and how that kind of stuff works, or um, working with what's a healthy diet, those kinds of things. And Yes, they do offer that for teachers and staff. They offer incentive programs. But again, I'd like to increase that community involvement. Another mistake that you'll find often with Health and Human Services does pertain to the nurse. And it's not common, but it does happen. And it's mistakes with medication dispensing and administration. Sometimes they'll have over the counter stuff that parents might send in, but it's got to be all in the original bottles. It's the labeling, it's the paperwork, it's all kinds of things like that, or maybe something's mislabeled. So in order to work with this, I want to increase the training and communication for everybody, for teachers and staff, especially as it's focused on the 7 high needs. And that includes vision, asthma, teen pregnancy, aggression, violence, physical activity, breakfast, and inattention and hyperactivity. I'd really like to focus on that breakfast one because it's important that students are eating and that they are ready for the day. If they're not they don't have proper nutrition, then they're not going to be focused for the rest of the day. So getting teachers aware of all these different problems, they can learn to look for warning signs, and they can work with the nurse, they can work with the counseling department and Health and Human Services, so that way it's a more cohesive program. Thank you very much. I hope you enjoyed this presentation. If you have any questions, feel free to send me an email.